Have you ever thought about doing what's known as a non-surgical rhinoplasty or a liquid rhinoplasty? And if so, I'd like to shed some light on that for you. Oftentimes people are, especially in this day and age, are thinking they can have big changes without any surgery. And to be honest, you can have some changes made to your appearance of your nose without requiring surgery. However, you need to understand that there are, pros, and there are also cons to this. The big pro is that you don't have to undergo anesthesia. You don't have to have any incision. Downtime for the most part should be fairly minimal. However, the downside is that if done incorrectly, it could look bad. And the more dreaded and feared complication would be having a risk of vascular compromise, in which case what would happen is that can affect the skin on the nose, and you could lose skin and certainly be left with significant scarring and a defect, which is something that would be very difficult to fix and ultimately would require surgery. Now, with that being said, there are times that an injectable rhinoplasty can work well for people. I often guide patients to think about doing that when they're trying to, make their nose look better, let's say for a big event, let's say a reunion, a wedding, for instance. In those situations, thinking about doing the injectable rhinoplasty is not a bad idea. You can also think about doing it, let's say if you're on the fence about doing a rhinoplasty from a surgical standpoint, but you want to kind of see what it may look like, then you could do an injectable rhinoplasty. Now, you can't just do an injection on any part of the nose. The area where I tend to use the injection option is if somebody's trying to camouflage a dorsal hump. And the reason why the injection is a good option for that is you can oftentimes inject above the dorsal hump in this upper part of the face. And the reason why that works well is you can place the injection on top of the bone. There's a fair amount of soft tissue here that as you put the injection, it can build up that soft tissue. And when you do that, it'll fill in this void and it can camouflage that dorsal hump. Now, you can sometimes put some filler over the dorsal hump or below it to camouflage it. But realize you got to be very careful with what fillers utilize. My advice is if you've never had an injection rhinoplasty before, use the hyaluronic acid fillers. They're more like a jelly. And if you don't like the way they look, they are dissolvable. God forbid you have a complication, you can dissolve it. Now, the one thing to realize though, is that once you get past this area in the nose and you start working your way down, the skin gets very thin. All right. And over the top of the nose called the dorsum, you can feel the skin moves fairly easily. And because of that, you can place the filler there. But with that, there's a very tight margin of error because if it's not placed correctly, it's going to be seen very easily. Now, the other benefit of using the clear jelly type fillers is that you can mold it yourself. And that kind of allows you a little bit of clay to work with it. As you get particularly down to the lower part of the nose, you got to be very careful. And the reason why I know this, because I'm a facial plastic surgeon, is that skin is very adherent to the cartilage. And trying to get the skin to dissociate the cartilage to manipulate the appearance of the tip just really isn't practical. So if you're trying to make your tip look different, I would strongly urge you to rethink that because, the result you're going to get, it's probably not going to be what you're looking for. The risk of having a problem, I think, goes up, in my opinion, compared to doing a filler in other parts of the nose, and it's not going to last very long. Now, you can also place some filler in the lower part of the nose. And again, you can do that. But when you're trying to, change the appearance of the tip, the fillers are just not the way to go. And unfortunately, you really need to think about doing surgery. But ultimately, I just want you to understand that, doing the liquid rhinoplasty, it sounds great in name. It's just like people wanting to get, quote, a mini facelift. But to be totally honest, it's really best used when it's used up here. The other time you can use it is, let's say you happen to have some scarring. And again, you can utilize the hyaluronic acid or they're clear like a jelly type filler for different purposes, but just be careful with it. So I hope this sheds some light on using injectable rhinoplasty. Make sure that whomever does it has experience, discuss the complications, make sure that, God forbid, there's a complication, they have a protocol to follow. Here at Elite Facial Plastic Surgery, we have a protocol that's followed if that were to happen. And you want to make sure you're in the hands of somebody who can deal with this. So I hope this sheds some light on the process of doing an injectable rhinoplasty. Now, if you're not sure if injectable rhinoplasty is the right option for you, check out our rhinoplasty channel on YouTube. I'm uploading videos all the time to kind of shed light on the various procedures involved in facial plastic surgery. And also, we'll cover this topic as well as rhinoplasty as well. Hope you have a great week.